care community. My name is Vanessa Chambers with Care for Lives, Concierge Nursing and Wellness at your front door. I really wanted to touch on pre-procedural care. Now, our space of care is home care. So this is really taking care of everything at home so that you prepare yourself for the surgery you're going to have, as well as, which is the most important for our space, after surgery. So I really want to talk on orthopedic surgeries. Now, we get quite a bit of orthopedic clients. It's usually very, very short term. And we have two ways of going about it. You can either do a one-time visit, or you can have a nurse stay with you for hours. Now, what I found that really helped, whether it's one visit or if you plan on having a nurse stay in your home for an extended amount of time, is that pre-procedural home assessment. Why is that important? Well, think about it. You've never had surgery before. All right, maybe you did. You've never had hip surgery before. It's your very first hip surgery. You can talk to all the friends that you want, and they can get you prepared, and you're still nervous because you're not 100% sure, right? Well, having that nurse come out to your home and make sure that your home is the way that it needs to be when you get back is so critical. Even just giving that education to the family members to make sure they look out for things. Such in fact, carpeting. Well, I've had my carpet on my floor for years and I've never tripped over it. I was like, well, have you ever used a walker before? Have you ever walked with a cane? No. Well, you will be post-hip surgery. And having loose carpets might lead you to possible falls. One thing you don't want to do post-surgery, any surgery, is have a fall. So that's one thing that you can mitigate right there. Just gain that education. Tack down your carpets. Another thing is pretty much would say for itself is making sure you have all the equipment in your home. So if you're coming back and it's like, okay, well, what about ice? Do you have ice in home? Do you have the right type of ice packs? Because you have knee surgery. So I know of a company that has great ice wraps. I know NICE, nice. Literally the company's called NICE. It's really, really, really good. They're great to use for clienteles. Do you have that raised toilet seat? If you do not, what kind of toilet do you have? Because there's several types of raised toilet seats, and not all of them are a monolith. It doesn't just work for all toilets. It works for some toilets or most toilets. These are the things that kind of people just gloss over. They don't really even think about. Sometimes it lacks for just someone to take care of them in the day and forget that sometimes they like to wake up at night, need help, and there's no one there. Pre-procedural care, I think, truly mitigates a lot of future issues. So I believe that's incredibly important to have. So I made like multiple lists of things that you want to take care of pre-procedurally. And one of those things is definitely making sure there's a thorough home assessment. Making sure that there is a full assessment on you. What's your baseline? Like, what are you like prior to surgery? So that we can see the difference post-surgery. That includes your vital signs in general, too. Family dynamics. Are you going to have family over? All right, you tuck me in and I'm here once a day for just 1 hour, 1.5 hours. But who else is here with you at home? Can you manage everything on your own? Did you have prearranged meals coming in, or are you going to try to cook? Are you really going to have the energy or desire to be on your feet that long to cook? A lot of pre-procedural will mitigate a lot of issues and make your life so much easier. So having that one visit by a nurse, assessing your home, assessing you, and then going over everything that you need to change or need to get in your home is so helpful for a lot of clients. You know, just having that second eye, and that second eye just happens to be a professional, really, really helps. I say that all to say that if there's one thing that you can do, I would say make sure you have that professional come out to the home prior to surgery and make sure that they do a full assessment so that when you get home, you have things covered. If you're not going to have us at your home 24/7 or even at least 12 hours or at least 4 hours, then at the very least make sure that you and your family are well informed. So and at least one post-surgery would mitigate so many future issues. Well, that was my little talk for today. I hope you have a wonderful morning, afternoon, whenever I actually post this. And take care, care community. Bye-bye.